Imagine this. You wake up one morning, reach to put your feet on the floor, and immediately feel a strange heaviness in your legs, almost like you've been wearing ankle weights all night, and you think, that's odd. But you shrug it off. However, what if that heaviness, that slight swelling around your calves, is actually the very first sign of something called chronic venous insufficiency, a condition that's quietly affecting millions across the United States right now? And if you don't learn what's really happening in those veins, and act fast, you could unknowingly be on a path toward painful complications that no one wants. Within just seconds you're hooked, because this isn't just medical jargon. It's your life, your legs, and your future quality of living, and you'll regret turning away before discovering the single most overlooked early warning sign that even doctors say too many Americans miss. Before we dive deeper, picture this. Show image 1, CVI leg symptoms diagram medical stock photo. A clear visual of where blood flow gets sluggish in your legs, and you'll know instantly this could be you, especially if you've ever spent hours sitting at a desk or had a job that keeps you on your feet all day. Now, let me connect the dots. Chronic venous insufficiency, or CVI, happens when tiny valves in the veins stop working properly, and instead of flowing smoothly back to your heart, blood pools in your legs, creating pressure, achiness, varicose veins, swelling, restless legs, cramps at night, even skin discoloration near your ankles, and yes, those spiderweb purple veins you may have ignored. We'll explore all of this with vivid clarity. Cut to image 2, varicose veins close-up leg stock image. You'll actually see what's going on beneath your skin, you won't just hear about it. We'll talk about the most common risk factors affecting Americans: age, because valves weaken as you get older; obesity, your body weight adds extra pressure on veins; genetics, if your parents had varicose veins, your odds rise; pregnancy hormones and fluid shifts; plus long hours standing or sitting without movement; diabetes, hypertension, all super relevant here in the US. And to keep you absolutely stuck to the screen, we'll interweave real-life used-based patient stories. You'll hear how one graphic designer in her mid-40s thought her leg soreness was just part of life, until she got skin ulcers that took months to heal, turning what she called a small itch into a big wake-up call. Then you'll learn the 6 critical signs you must never ignore: leg heaviness that worsens as the day goes on, ankle swelling that disappears overnight but comes back like clockwork, visible bulging veins, darkened or hardened skin near your calves, night cramps that jolt you awake, and wounds or ulcers that just won't heal normally. And these signs aren't rare, they're the early alerts of CVI. We'll time them with expert doctor explanations so it doesn't feel dry. Every point will come with medical clarity and urgency. Want to visualize it? Show image 3, healthy blood circulation animation leg stock. See healthy veins versus damaged ones and understand the exact mechanics of valve failure and blood pooling. And here's a quick take. While CVI might seem like a cosmetic issue, those ugly varicose veins, it's so much more. Untreated, it can progress into painful leg ulcers that stay open for months, recurrent skin infections called cellulitis, hardening of tissues, lipodermatoses, and even increase your risk of blood clots or deep vein thrombosis. And for Americans with busy lives, ignoring it could mean sacrificing mobility, comfort, even your independence. This is not minor. That's why right now, as you're watching, I want you to feel the weight of action. We'll go deep into prevention and solutions in a US-savvy way, simple lifestyle tweaks you can make today, like taking a brisk 20-minute walk after work, elevating your legs above heart level while relaxing, swapping out your desk chair for a footstool to encourage movement, staying hydrated, managing your weight. Every tip timed to moments in your day, with clear visuals, not just instructions. And to support that with reality, I'll tell you why wearing the right compression stockings, graded and approved in the US, can reduce symptoms up to 60%, yet 70% of Americans don't use them properly. We'll show images of proper fit, feel, and when to wear them, from morning with an image of a morning routine to evening with post-work leg elevation, and we'll flag common mistakes to avoid, like wearing the wrong size or forgetting to wash them. And you'll see what doctors in vascular clinics in the US actually tell their patients, because this isn't opinion, it's best practice medicine. We'll even cover when to seek advanced medical care, like duplex ultrasound imaging and venous reflux studies. So you know what questions to ask your doctor, how the tests work, and why catching it early changes everything. To keep it intimate and motivating, we'll use a calming stock image. Show image 4, elderly walking outdoors peaceful stock photo, representing the life you can preserve by taking action now. That could be a weekend walk in the park or playing with your grandchildren without pain. Next, we'll contrast with an image of a doctor-patient interaction. Show image 5. Doctor consulting patient vascular clinic stock. To reinforce that expert-led, proactive conversation that starts with your awareness and ends with personalized care plans. Throughout, the tone stays urgent. Every few sentences ask questions like, does this sound like you? Can you feel that tightening in your calves right now? Is swelling still here after sitting through a movie? Because if viewers blink, they might miss the moment they connect the dots to their own health. We're not just presenting facts, we're telling a compelling, visceral story about blood flow, body awareness, and empowerment. You'll be reminded, if this info existed 20 years ago, I'd have avoided months of leg pain. So don't look away now, don't scroll, because every second you procrastinate learning could bring you closer to complications that are harder to reverse. And here's the grand payoff. At the very end, you won't just walk away with more knowledge, you'll get a downloadable, printable US CVI action checklist with 5 steps you can do today. Track leg symptoms, commit to a 20-minute walk, elevate legs nightly, order the correct compression stockings, and schedule a venous ultrasound with your local US vascular specialist. Plus, I'll remind you of the first alert symptom most people miss during a family holiday when everyone's tired and legs ache, and recognizing that moment, early, can be the single thing that preserves your mobility. So stick with me, don't skip ahead or stop watching. Because this video is your guide to maintaining healthy veins, protecting your mobility, and living future-focused, starting now. You'll leave equipped, motivated, and prepared to act on your vein health immediately, and your legs will thank you.